I'm Dr. Hal Stewart.
Hi, and I'm Dr. Adriana Corridor Stewart.
You know, we see patients in our practice here in Flower Mound, Texas. But we see patients from all over the country. We're very close to Dallas-Fort Worth International Airport, so it's very easy to reach our office. But we have a lot of patients that will have a consultation with us, you know, on via Zoom, a telemed conference, and they just can't come here. They want to find somebody that does something similar in their area. So we just wanted to briefly tell you some basic things that you should look for. First of all, when you make an appointment with a doctor, they should send you a questionnaire with a detailed medical health history, a detailed dental health history, and questionnaires with an Epworth sleep questionnaire is very important. Is it the HIT6, which rates your headaches and how that ties into issues as well. So very thorough questionnaires, and usually, you know, I think ours, or when you fill everything out, it's probably around 20 pages or so. And I know it seems monotonous, but that is so important. We get those and we read them. We actually read them for every patient because having a health history is so very important. So number one, that should be the first thing. Secondly, when you do go in for appointment, then you should there's a bare minimum of medical records, and you know, we call them medical records, but medical dental records that should be taken. You want to expound on what those records
Sure.
are?
Diagnostic records would include a CBCT scan, which is a 3D image of the head. So important. There's so much valuable information that we gather and that we observe from that.
And it needs to be the entire head and neck, so all the nasal passages, yes, and the temporomandibular joints, the airway, and the cervical vertebra can be viewed.
Yeah. Set of x-rays, dental x-rays inside the mouth. There's a sleep study, extremely important if it warrants for a sleep study if your symptoms or you're having and experiencing sleep issues. A sleep study that's dispensed to take at home is so valuable. What else?
Photographs.
Photographs, absolutely.
Full photographs of your intraoral photographs of the face, full body photographs, so we can see your posture and see any misalignment. So those are very important as well.
Yeah. Any diagnostic records, because the more as a dentist that we have about this particular patient, the better we'll be able to explain, or the dentist will be able to explain and go over review of findings. So very important. The more you get, the more options that a dentist can give you as far as treatment, and the more you'll understand what might be the right option for you.
Right, and if you're looking for a whole total wellness, and you're going to a total wellness, holistic type dental office like ours, the last thing that we look at are the teeth. I mean, that sounds kind of counterintuitive, but the teeth are the last thing that we look at. We look at the foundational. We go foundational first, and we take care of that first, and then the teeth are the last thing that we treat. So when you go in for an exam, even if you call ahead of time and ask what the exam is like, if they immediately jump to teeth, then that might send up a red flag, because there's a lot more that needs to be looked at than the teeth. Now, having said that, if a patient comes in and, you know, in our exam we get to the teeth, if they've got, you know, massive abscesses and large bombed out teeth, we're going to give that a priority because that's active disease in their mouth. But we're not going to do a lot of elaborate dentistry on any of our patients until we've looked at the foundational things first. And then once you've had all the records taken and you've had your examination done, you should expect to be in the office for about an hour and a half to 2 hours for that. That's what we schedule for our patients. The doctor should then gather all that information and then meet back with you for, you know, at least half an hour to an hour to go over everything. And at that time, and only at that time, will treatment recommendations be given. Because until we've seen everything, the sleep study, the scan, the CBCT scans, the photographs, all of our intraoral examination records, until we put all of that together, we can't really recommend treatment, because the best treatment for you is based upon your accurate diagnosis. And that's what we're doing with all those records. We're making a proper, accurate diagnosis. So hopefully this can help you. I know it's a little bit of a long video, but it's an important decision. So hopefully this helped you. And if you want to contact our office for a consultation, a telemed conference, please do so. We'd love to meet you.